Like I think about, like my mom, for instance, became handicapped after a stroke, and just going to doctor's appointments is like a production. She's a patient that needs probably a little bit more medical attention than an average person. There's no easy way to even get to the doctor to get the basic care. It seems strange that in a healthcare environment that simple things like that are not thought of. Like, how do you just getting a wheelchair into a clinic is like a nightmare. Yeah, it takes three of us. Two of us have to take off work to go to one appointment that really only consists of refilling a medication that you've been taking for years.
I was understanding there was some type of injustice of some sort because we couldn't get certain things. We couldn't get certain help in certain areas because they wanted you to be either more worse off than you are or you didn't qualify at all. It's hard. Even for me now, I don't have healthcare right now. So I have to watch everything I do because I worry about money or the bill. I know I have some things that need some attention. But in the back of my mind, it's like I don't qualify for the Medicaid anymore. So now I have to buy into something. I'm like in the middle. And I could see like when they either want you to be real poor or not poor at all.
When you look around in our community, the near hospital might be 10 miles or 12 miles. That for a community that doesn't have no transportation, 12 miles, it is a huge distance, especially when you are poor and you might have only one car in your family, and the car is being used to somebody to go to work and provide. And so people don't really understand the some of the issues or factors or determine health factors and they're not ready to invest.
I think that the saving grace is insurance, just the fact that, I had it, but I feel like if I didn't, I don't know where my knee would be right now. And I think that they definitely prioritize that. I get it. But I feel like that shouldn't come so much first. I mean, I'm a human being, somebody's in pain. Let's figure out ways that you can help me, like things you can suggest. I felt like, okay, if I'm being really honest, I felt like what they suggested really differed the minute that they found out that I had like insurance that covered all of this.
I've had some really big surgeries in my life, and the thought of a human being able to have the intelligence and the technology to cut into my body and fix something so that I don't pass away and I get to live, until I'm old, I'm forever going to be grateful for that. And I keep that tucked in the back of my head while I live, because I don't ever want to take it for granted. On the other hand, I wish that not just healthcare, but everyone could try and treat, like what if your mom or your sister or your brother or your son or daughter needed that healthcare and they couldn't get it? How would you feel, and what would you want done? And I think that we can all come to agreement that, when it comes to our loved ones, to ourselves, that we just want a fair chance, just a fair shake and a fair chance to live life